everybody. I'm glad you could join us. I'm Janet Place from the University of South Carolina, and I am co-chair of along with Amy Lee,
Hello.
of the Core. What?
Hello, I said.
Core Competencies work group, and I'm really thrilled to have so many people on, and there are many new names, and I think that's very exciting. Amy, you want to introduce yourself?
Yes, absolutely. I happen to be Janet's co-chair, and I am professor and program director of the Consortium of Eastern Ohio Master of Public Health Program, and I am based at Northeast Ohio Medical University.
Great, thanks. I think now we're going to let Janelle go over the housekeeping items.
We are. Thanks so much, Janet. Just to let everybody know, all attendees that are on the meeting are currently muted. Make sure, please, that if you've called in over the phone, please choose the phone call option on your control panel and enter your audio pin. If you've called in or if you've joined using a computer mic and speakers, please choose the computer audio option on your control panel. We will have lots of opportunities throughout the meeting for questions and feedback, and are looking forward to your active participation in the discussion. So to have your phone or mic unmuted so you can speak, please use the raise hand feature. You can also type your questions or comments in the questions box in your control panel on the right of your screen at any time during the meeting. And as well, the agenda and slides are available for download in the handout section of your control panel. And just as an FYI, we are recording this meeting, so we will make the archive available to you and other workgroup members who are unavailable to join us today following the meeting. And back to you, Janet.
Okay, thanks, Janelle. It looks like, here's the agenda for the meeting, and it looks like we have a lot on it, but we really want to make sure that we're hearing from you as much as possible. So there will be some reporting on updates. We're going to update you on the subgroup work. The subgroups work on performance improvement competencies, and an update on the most recent Counsel of Linkages meeting. And we really want to spend some time talking about how we demonstrate impact of the core competencies. And then Ron will talk about discipline-specific competency sets that are based on the core competencies. And then we'll talk next steps. So let's go ahead, and I'm going to pass it to Julie Sharp. Oh no, I forgot this slide, sorry. Yes, this is like our creed, must be said before every meeting. As many of you know, and the Council on Linkages between academia and public health is an organization of 22 national public health organizations, and among their many priorities, well, their big priorities are workforce development, quality improvement, and you can just see over here that you can see the list now and of the organizations involved. All right, now I'll turn it over to Julie.
All right, can you hear me okay?
Yes.
Great. Hi, everybody. My name is Julie Sharp. For those of you who are new on this call, I'm a performance improvement specialist with the Public Health Foundation. One of the projects I work on here with PHF is to develop and refine a set of competencies for performance improvement professionals in public health. We have a subgroup of the core competencies work group that is focused on this project. So I wanted to give you all a brief update on where we are with regard to that project today. The subgroup held their most recent meeting in June, just a few weeks ago. And during that meeting, the subgroup provided their feedback on a summary of information that was gathered during a series of listening sessions with performance improvement professionals. We held those listening sessions in the spring of this year, and in those sessions, performance improvement practitioners were asked to give their input on 4 different topics. The first was what are the knowledge, skills, and attributes that are necessary for a PI professional? What are the current strengths of performance improvement as a subdiscipline of public health? What are the current challenges for that subdiscipline? And what are the needs for performance improvement practitioners? The subgroup talked about the major takeaways for each of those 4 topic areas and how that information would be integrated as a component of the environmental scan report that was developed last year. The first part of that environmental scan report was a robust literature review, and then we got information and input directly from practitioners as the second component. That environmental scan report was completed in late June and submitted to our partners at CDC, with whom we have a cooperative agreement for this project. CDC has had opportunity to review and provide comment on their environmental scan report, and we are hopeful that that report will be finalized within the next couple of weeks. Moving forward into this year, the subgroup is going to be working on taking the results of the environmental scan and crosswalking those with the current draft of performance improvement competencies, and using that to determine what changes are needed, what additional competencies might need to be added, or if there's need for any deletions. Once the PI competencies are revised, we're going to undergo a collaborative and comprehensive vetting process with both partners and with practitioners. We would definitely welcome the feedback of this work group as well. And as we get closer to rolling that out, we'll be providing some information to this group on how you can be involved and how you can help us spread the word about this vetting process. So I'll pause there and see if I can answer any questions from anybody.
Not seeing any, Julie, but I'll just keep this for a second.
Okay.
Yeah, no, none at the moment.
Okay. All right. Well, thank you all very much, and I will turn it over to Amy.
Julie, thank you so much. Very exciting, very exciting. I am going to now share some highlights from a meeting that we just had with the overall Council on Linkages. Just a real brief summary. So they met for its second meeting of the year last week on July 17th. And this meeting featured a number of speakers and updates on various efforts of interest to the Council on Linkages. And so we had speakers from the CDC who provided an update on CDC priorities related to Council on Linkages activities and public health workforce development, and also a speaker from Trust for America's Health who discussed the current public health environment and support for the governmental public health workforce. And also we had a representative from the American College of Preventive Medicine who shared a consensus statement which was focused on the preventive medicine physician licensure. Probably of most interest to this work group were a couple of organizations, the Association of Public Health Laboratories and also the Quad Council Coalition of Public Health Nursing Organizations, who discussed competency development specific to their disciplines and their implementation efforts. The Association of Public Health Laboratories, which collaborated with the CDC to produce the competency guidelines for public health laboratory professionals, is now working on building awareness for their competency set and supporting implementation. And as a part of this effort, they've recently released an implementation toolbox that offers a variety of tools related to their competencies, such as a sample position description and career ladders and competency assessment tools. And that toolbox is available on their website at www.aphl.org. Again, www.aphl.org. The Quad Council produces the Quad Council Public Health Nursing Core Competencies, which are very closely aligned with our core competencies. And they're currently in process of updating these competencies to make them current with our 2014 version of the core competencies. And then finally, they discussed updates on activities related to the academic health department, learning community, and the core competencies. And they highlighted the recent release of the new core competencies tool, which we're going to talk about in a minute. And they shared current data related to the use of the core competencies, which Janet is going to discuss later on. So what I'm going to discuss now is an update on the status of the core competency revisions. So as you might remember from our last work group meeting, the Council on Linkages was scheduled to meet in April to discuss whether to open the core competencies for review and possible revision. This has been, of course, a lot of the work of this particular work group, you know, reviewing the competencies, preparing them for revision, and then ultimately coming up with revisions. But at that meeting, the Council on Linkages decided that a revision would not be undertaken this year. And the decision was based on the increasing usage of the core competencies that's being seen in the role and the core competencies are playing in the broader workforce. The development efforts and requests that have been received to consider lengthening the revision cycle to minimize disruption within the field and just allow time for organizations and agencies and individuals to integrate the latest core competencies into their work before the revisions are made. There have been so many revisions that you just want to take a breath and, okay, let's try to incorporate these revisions or the latest revisions and really see what we can do with them. So the work group is going to continue its focus on tools and resources that can support individuals and organizations with integrating the core competencies into their workforce and development efforts. And as I said, Janet's going to share with you the breadth and scope of how much people are using these core competencies. It's very exciting. Okay, so for the next slide, I'm going to update the prioritization tool based on the modified core competencies. And Kathleen Amos has done so much. She's pretty much put this tool together. So if any of you have any questions about this tool, I'm going to bring Kathleen to answer questions about it. But let me give you a summary first. So as you know, one of the ways that the core competencies are used is the development of competency-based job descriptions. And during the March work group meeting that we had, we shared a draft of the prioritization tool based on a modified version of the core competencies for feedback. And so thank you to everyone who provided comments on that tool. And now this is the ta-da, march out of the tool that has been finalized and is actually available online. It's called Determining Essential Core Competencies for Public Health Jobs, a prioritization process. And it describes a process for prioritizing the competencies for job descriptions using this modified version of the core competencies that groups similar competency statements together to simplify working with the competency set. So public health organizations can use this process in a workshop setting to engage staff members to identify and prioritize the core competencies that they feel are most important for their particular roles. And so as I said, the final version of this tool is available for download in the handout section of your control panel there, and also through the Public Health Foundation Council on Linkages website, along with worksheets and spreadsheets that you can use in your workshop setting to implement this tool. This tool, and a great example of how Denver Public Health engaged in and built on this process to support the competency development within their organization, was featured in a recent webinar. And the webinar was called Determining Essential Core Competencies for Job Positions. And it was archived, and so you can also view it through the website. Also, the process described in the tool was used for a workshop in the 2017 Public Health Improved Training in June. And Kathleen worked with Elizabeth Rumble and Katie Amaya from Denver Public Health on these events. So thank you so much. Elizabeth, I believe you're on this work group meeting and you're viewing this. So thank you so much for your involvement in trying to promote this tool. We're also happy to share that the presentation based on the tool has been accepted for the American Public Health Association annual meeting in November. So if you're planning to attend APHA, mark your calendars for this session on Monday, November 6th. It's from 12:30 to 2 p.m. and it's session 3271. And of course, there will likely be other competency presentations as well. So that is the presentation about the tool. Does anybody have any questions about this tool? And likely I will let Kathleen answer any questions if people have any answers about this great tool.
Thank you so much, Amy. And just as a reminder, please feel free to use the raise hand feature. We can definitely unmute you so you can join the conversation that way. And also at any point, also you can use the questions box to submit them via that functionality. Thanks so much.
So Elizabeth, if you're on the line, I was wondering if you might be able to also talk to us a little bit about the experience that you had in that work group meeting. Maybe make a comment about the tool if you're willing.
I don't think she's on today, Amy.
Oh, bummer. Okay, too bad. Okay.
She may have planned to, but I think she's not currently on anyway. She might join us later.
Okay. Well, at any rate, this tool has been piloted and it's been in work group settings, and so we encourage you to take a look at it. So I think maybe Janet, you're up next, and you're going to talk about the impact of the core competencies. Yes.
Maybe
Yes.
there is a question or comment that came in through the chat.
Okay.
We do have one question, which I guess I will read, and then I'm happy to answer. It says, the Region 2 Public Health Training Center is currently working on a manuscript for the Journal of Public Health Management and Practice about our methodology to condense the core competencies for our training needs assessment surveys for local health departments. Are there other manuscripts in the works on this topic, e.g. for the prioritization tool based on the modified core competencies? So first, that's awesome, and I would love to learn more about that and your process and what you're working on. Second, no, we do not currently have any manuscripts in the works related to this tool or any others. I don't know if other people are working on them, but we do not have any.
And Region 2, this is Ron. Region 2, is that the one where Columbia University is the PHTC? If whoever asked the question,
yes, it is.
Okay, came in, yes, yeah. So we, I guess for at least a year, we've been working with Columbia University with that shortened list of or consolidated list of competencies. So really, it would be interesting to see the manuscript and to see how what it is that we had developed maybe was used to help the Columbia process as well.
Any other questions?
She says, Ron, I'll email you with more details.
All right, thank you. Appreciate it.
Perfect.
Cool. Okay, so we can go to the next section.
Okay, we are going to move on to talking about how we demonstrate impact of the core competencies. I'm going to share with you what the council has done in collecting data, but we really want to spend a bulk of our time in this meeting talking about your suggestions or resources for demonstrating impact of the core competencies. Okay, next slide. Okay, so here's a graphic which is very exciting, and as Kathleen, I think, mentioned earlier, and Amy, you can see how much more the updated core competencies have been accessed, and this continues to grow. So, and the core competencies are the most accessed resource on the Public Health Foundation site. So you can also, over here is also the information on the academic health departments. If you're interested, that's another major project of the council. Can move on. All right, here's how, this is even more, or even easier to see. You can see where the technical assistance has occurred in the United States, and this does not include, I mean, some of these states that did not receive technical assistance may have received it, and almost certainly received it in previous years. So this is in 2017, and you can see that it was even so spanned as far as Guam and Nepal. Only, unfortunately, staff didn't get to go there to provide it face to face. But you can see where they're really covering and more of the country all the time. So very exciting, and goes with what Amy had to say about the reason why we're not going back to the table and updating the competencies at this time. Okay, so we know that we can get data for how many people have accessed the core competencies and how often the council is asked for technical assistance or other resources on this. But what we want to hear from you is other suggestions for demonstrating impact, either suggestions of something you've thought about or something that you're doing that you think will help the council do even more to demonstrate the impact. So we can open it up. I mean, we've heard some, we've heard some already just in developing more tools, and that's part of it. But anyone working on anything, and Kathleen and Ron and Janelle, please also chime in.
Janet, this is Ron. I'm wondering if Samantha, who talked about the article being written, if there's anything in there about, excuse me, how the competencies are being used, or how helpful they may be or not.
Yes.
And if Samantha, if you wanted to say anything, we could unmute you.
Yeah, Samantha, I see your hand is raised now. I'm going to unmute you. You're unmuted.
Hi, everyone. So my name is Samantha Sinek. I'm the program coordinator of the Region 2 Public Health Training Center. I wish I had a couple more details for you, but just in the meantime, Angela Idala, our evaluator with the center, as well as her research assistant, Brittany Cavalier, they are working on a manuscript about how we condensed the core competencies in order to survey training needs of the local health departments in our region. I'm not quite sure exactly, aside from publishing that manuscript and showing our methodology, how that really demonstrates impact. I guess it is a development of a tool, but it's not quite the same as counting numbers for access. So, I mean, we can definitely give you anything that we write, and it will be published, but I'm not sure if that's what you're looking for.
Well, I think it is a kind of impact. It shows that you are using the competencies for this purpose. And in South Carolina, and the State Health Department, for their FAB accreditation, is also doing a comprehensive training needs assessment that includes the environmental part, and that's the first time that's ever been assessed in its entirety in South Carolina. Usually it's just the health side. So we've had to develop an instrument that would meet the needs of both the public health and then the environmental side. And that was a really long process, and we did have to condense things. And we also added a fourth tier, the pre-tier for admin. And so, I mean, I'm happy to share that as well. It's just been deployed here, but we had to go through the same process of making sure that people understood it, and most significantly having to de-public healthize competencies for environmental health folks who for some reason don't get that they are public health. So any work in that direction and what you're doing there at Columbia, I think that's going to help a lot of people.
And it looks like Angela has her hand raised as well, so I don't know, Janelle, if you can open her line too.
Sure. Hi, this is Angela Della, and just to kind of add to what Sam had said, I think the other piece of it is, and that I totally agree that that's been part of the challenge, particularly in Virgin Islands, Puerto Rico, places that are part of our jurisdiction, part of our region.
Oh, you poor people.
The issue is an assessment tool that would be useful for in areas where they don't they don't have a staff that has a high proportion of people with formal mental health, public health training at all. And again, the issue of, well, how does this help me develop better trainings for, I don't know, folks that are septic tank inspectors or whatever. So I think the kind of impact of it, how to, we only had, I don't know how many hundreds that we finally had done across all New York State, New Jersey, Puerto Rico, U.S. Virgin Islands. We only had one, maybe two persons said, what does this relate to my job? But I will say also that we included in our assessment tool a framing of this as related to the essential public health services, and included separate questions also about each of the 10 public health, essential public health services. And it was interesting to see how people might have given an answer there, in qualitative answer in terms of specific needs that would also match what they gave under one of the categories of the competency. So anyway, that'll be part of the discussion of the paper that we do. We're certainly happy to share it, and thanks to Ron and everyone that helped us along the way to kind of take advantage of this, your work that was in process to arrive at our, the shortened list.
That's great.
Janet, there is a question that's come in here on chat, but before Kathleen reads that, if I may, for those of you who are practitioners on the phone, if you think about examples that you might have and impacts that you might have seen in terms of workforce development plans you may have developed for public health accreditation, board accreditation, or use in job descriptions, performance evaluations, things of that nature, that would be really helpful to hear as well. We are getting some data from FAB on those who explicitly note core competencies within their workforce development plans, but FAB can't give us more than that because of the confidentiality requirements.
That's excellent.
We just know sort of yes or no. So should we read the?
Yeah.
Okay. Read the question.
Yes.
Oh, Kathleen's computer went down for a moment. Okay.
We're here. So the question says, or comment/question says, we've been working in Southeast Wisconsin to make the competencies fit with other sets and make it actionable by putting it in an assessment format for local public health staff. I'm curious to see how others are implementing it. Maybe a national quick survey. So if you will indulge me for a moment, I have a couple of thoughts, and then I'm happy to hear what everyone else has to say. I will preface this with the information that we, at least at the Public Health Foundation, in terms of how all of this competency work is funded, are very limited in our ability to do surveys, in that we can't do them, essentially. So we have talked about that, but it's not really something that's in the cards, at least for us. Not that that should prevent anyone else from doing them. So one thing in terms of that does help us, I guess, get to some of that, and it tends to be more quantitative, at least in the information we have seen, rather than qualitative, is that there are questions in the profile studies that are done. So the Association of State and Territorial Health Officials and the National Association of County and City Health Officials both include questions on their profile studies that relate to use of the core competencies of how, whether people are using it. And so we have data that shows that over 50% of state health departments and close to 50% of local health departments are using the core competencies. With the most recent NACHO study, the data that they put out breaks it down into various categories, like the competencies being used for job descriptions or training needs assessments or whatever. I'm not sure off the top of my head exactly all the categories, but it does give you a little bit of that information. The way we have kind of, or I think one of the ways that we've sort of tried to capture some of this more qualitatively is by hearing sort of what we're doing right now, like the examples of how people are using the core competencies. And we are going to be working over the next year to build out sort of a better section on our website, a place for that to live, where we can bring that information together and make it accessible so that people can see what other people are doing. I know that doesn't get at the idea of like surveying and having a better idea of how many people are doing what, but we're hoping to better be able to highlight and share stories and experiences that way.
You could do a meta-analysis then, so that would be great. Anybody else have any ideas on how we could demonstrate impact or ways in which you are demonstrating impact? I can't see it if somebody raises a hand, so.
Right. We're keeping an eye on it.
Okay. We have some marks in the question box.
Yeah, I think we've gotten through all of those.
Okay, yeah. Do we hear from Jen Freiheit? Okay. Of course we did. Okay. I got caught up in looking at the scrolling.
Right.
All right. Well, Ron, Kathleen, Janelle, anything else to add? Because it sounds like we could go ahead and wrap up this part.
Sure. So I guess from where we stand right now, we're going to continue. So we will continue to pull the sorts of data that we shared with the quick couple of slides here in terms of the TA that we provide or visits to our website and those sorts of things. We also have data related to, say, how many people attended a webinar or how many people viewed the archive. So the webinar that Amy mentioned earlier, we had close to 200 people at the live event, and close to 200 people have viewed the archive since that was posted. And so we kind of have access to all of that. So we'll be playing around to see what we can do with that and trying to think of ways to make that more accessible, I guess, to people in a way that actually could be helpful or beneficial to people as they're working with the competencies. So if anyone has any suggestions or ideas, please feel free to let us know at any point. I will also, once again, I guess, put out a plea. I know Ron mentioned examples of workforce development plans, job descriptions. Yes. We have collections of those on the website currently that we're looking to continue to improve and build upon. And so if you do have things that you're willing to share, able to share, we'd love to see them. And Absolutely. As we work through the redesign of the sort of, we call it the shorthand as our examples of use section, but as we're working through redesigning that to better highlight the stories of what is happening in the field, we also will need those stories. And so to the extent that you're willing to share with us, we're more than I can't even emphasize how interested we are in hearing what everyone's working on, because I think that's really what makes it come alive for people at the end of the day. And we, you saw the map, we fill a lot of technical assistance requests, and often it is, I'm working on X, can you give me some advice, or how might I go about doing this? And so being able to share and connect people together who are working on similar things, I think is really valuable. So I guess that's my plea. I'll get down off my little soapbox.
No, that's great. That's exactly what I was going to say. You're the best person to be requesting it, and you are doing a terrific job of assembling all that stuff. Okay, so I'm going to turn it over to Ron to talk about the discipline-specific competency sets.
Great. Thank you so much, Janet. Appreciate it. So as many of you may be aware, a number of organizations have developed discipline-specific competencies with, sub-disciplines within public health. Excuse me. So the core competencies really are meant to apply across the board, and then disciplines often say, okay, for our particular discipline, we need to dig a little bit deeper in some of these areas and offer more specific competencies for our particular discipline within public health. So the slide that's up here right now are different discipline-specific competencies that we're aware of that have, to some degree, used the core competencies. And we have everything from, right up at the top there is the Quad Council for Public Health Nursing core competencies, where there's very explicit links to the core competencies and the public health nursing competencies. And so that list up on top, the first 5 there, are ones where there's a pretty explicit link to the core competencies. The ones below, the 4 others, are ones where to some degree the competencies have been used, but it's not always as clear what that link may be. You also will notice from the list that there is actually an increase in the number of discipline-specific competencies being developed. We can look at, Quad Council for Public Health Nursing core competencies, they're beginning a revision process. The competencies for performance improvement professionals that Julie Sharp talked about, the priority competencies for population health professionals, those are under development. The competency guidelines for public health laboratory professionals just released. The community health worker competencies, which are under development, and the including people.
Excuse me, Ron. Who is doing the community health worker competency work?
That one is, Kathleen, you could talk about that.
Yeah, so I believe there are probably more than one group developing health worker competencies currently. The one that we have been most closely involved with comes out of Tulane and Maureen Lickfield's shop.
Yeah.
Okay.
So we can.
All right. Sorry, I didn't mean to interrupt. That caught my eye related to something else working on. So go ahead, Ron. I'm sorry.
No, that's fine. So the point is that increasingly there are discipline-specific competencies being developed, and a question came up. Sometimes, actually, 2 different questions. Sometimes a question comes up from the developer of the competencies asking, does the Council on Linkages endorse competency sets, discipline-specific competency sets? And then during a recent Council on Linkages meeting, a question came up, should there be some type of, good housekeeping seal, if you will, of competency sets that have used the competency framework, the core competencies framework. And the Council on Linkages said, this really is a question for the core competencies work group to discuss. Clearly, if there was some decision that should be some way for the council to recognize discipline-specific competencies that use the core competencies, we'd have to get into what those criteria would be, how they would be reviewed, et cetera. But the first question really is there value to there being some way for the Council on Linkages to recognize organizations and sets of competencies, discipline-specific competencies that have used and build upon the core competencies? So Janet, let me open it up to folks for comments, questions, suggestions. We do not have the answer. It's a question, again, that the Council on Linkages is asking for the good thoughts of this work group. Silence is not always golden.
Well, the question is, have there ever, I mean, maybe this is something you wouldn't want to say out loud here, but have there ever been any sets of competencies that use the core competencies that have anything in them that would be objectionable?
Well, maybe I'll think about it a little bit differently.
Yeah, I mean, that's what
there are competency sets that say they use and build upon the core competencies, but you really can't figure out how.
Okay, I see.
Right, so it's that type of thing. As you know, as I mentioned, like the Quad Counsel ones, very, very clear. You can see that competency sets that we're working on. Well, we're going to build it in, of course. So the performance improvement competencies, the population health competencies, absolutely, you could see the connections. Excuse me, but you can't always really see them. And so the question is, how important is it to for the council to recognize that folks have actually done that and done it in a way that makes it clear that those core competencies were really built upon? And it looks like Kathleen might have I thought she might have a comment that came in, but no. I see. I don't know if Kathy Miner is still with us, but I will throw it out to Kathy. Kathy, if you were there, would love to hear your thoughts, because Kathy, you've been involved in a number of the discipline-specific competency activities, and I'm wondering if you think it would be at all helpful to have some way for the Council on Linkages to note what's of use or how they were used. And Kathleen, you have something?
There's a question. But I don't know what you want to do first. There's a question.
Oh, there is. Well, Kathy, are you there? Nope. Okay. So it looks like there is a question that came in.
So it says, I'm new to this group, so apologies for my ignorance, but Ron's question makes me think that the council is the mother of all sets and therefore able to designate which are good and awardable. From a local standpoint, we do not see the council set as the tip of the triangle, but equal and integratable with other sets.
Good comment. And what I'll say about that is that we've always said that the core competencies for public health professionals is a place to start. And really, this question about the discipline-specific competencies is really more geared towards those organizations who say our competencies are built upon the core competencies for public health professionals. Is there a way for us to actually note that? Would it be beneficial to note that, or is it just okay the way it is for organizations who some may use it a tad, some may use it maybe not at all, but say they do, and some may make it real clear. That's really the question that's out there.
And I think and Ron, forgive me if you said it and I was busy paying attention to something else. I think we've always envisioned it as there would be no requirement to be, if this was undertaken, there would be no requirement for competency sets to be recognized in that way. It was more that people were approaching us asking for that. So I think it would be a matter of if a competency set or a developer of a competency set wanted that, would we be willing or able to provide it?
Yeah, that's a good.
As opposed to us like trying to go out and find all the competency sets and figure out which ones match and which ones don't. It would more be if someone was asking.
Thank you, Kathleen, for the clarification. And in fact, it's always been difficult to answer that question when somebody says, can the council endorse these competencies? We don't really know how to answer because there's no process for doing that.
Mm-hmm. So there's a follow-up. The other point I wanted to make is that if the council started placing good housekeeping seal, if you will, it would place an importance on certain sets over others. And some locals would take that with such importance and neglect other sites without applying critical reflection to sets that are not recognized.
Any other questions, comments, suggestions for us?
There's a comment that says, is the aim to identify the foundational competencies for public health? So,
well, that's a tough one to answer because the core competencies for public health professionals were crosswalked with the essential public health service, and the foundational capabilities are really, I mean, there's been a crosswalk, I know, with foundational capabilities in the essential services. So it's reasonable to say that the core competencies encompass what's within the foundational. But I can't really say explicitly, we've not actually done a crosswalk other than look at the, there's the FAB crosswalk of the FAB standards and measures with foundational capabilities as well as essential services. I don't know if anybody else on the call has looked explicitly at the foundational capabilities and the core competencies. I don't know, Janet or Amy, have either of you thought about that?
Well, we've sort of have done that here in South Carolina, where, you know, we did a crosswalk of all the major competency sets related that we had when we did this, and so I have that, and it's something that I'm interested in working more on. If that would be, I could add new competencies to it, but I mean, what we found was that there's definitely that what's in all these specific discipline-specific sets does mirror the core competencies in some way. They can be crosswalked. That's what you're asking.
Yeah. And excuse me. So, you know, again, within the foundational capabilities, if one has, let's say, assessment, the components of assessment, you know, surveillance and some basic health sciences, et cetera, that's there in the core. And then in terms of laboratory capacity, well, that's in the public health,
right,
public health laboratory competencies.
Right.
Policy development, you know, the various components are really covered within the foundational capabilities. Now,
right.
something that I'll add, which may be not relevant, but you know, after the foundational capabilities activity was concluded, then there was movement towards the chief health strategist concept, also worked on by Resolve and a bigger work group. And with the community health strategist, or the chief health strategist concept, NACCHO is beginning an effort to look at what are the competencies needed for a chief health strategist. And one of the key documents they're using within that is the set of core competencies, and looking at, well, what else is needed beyond that in terms of leadership that a chief health strategist might need. So these things continue to evolve, but I'd say, again, the core is meant to be a place to start to look at what's needed to deliver the essential public health services, and as well as what's needed to really comply with Public Health Accreditation Board requirements.
So we have a question about accreditation, actually. So was the goal of these competencies to be a requirement of health department accreditation?
No, I mean, these competencies started before accreditation was even being spoken of.
Right.
Right. I mean, the initial set of competencies. No, it was really all along the core competencies were meant to say, what is it that people need to be skilled and competent in order to deliver the essential public health services?
Right.
Now, given that, and given that public health accreditation is built upon the essential public health services, it's fair to say that the core competencies have a great relevance to the Public Health Accreditation Board standards and measures because of that. And they're also, you know, the core competencies have been well vetted. It is something that 22 national organizations unanimously voted upon. We received over 1,000 comments the last time it was reviewed. So there's a lot of history there around the essential services. So Janet, Kathleen?
Again, forgive me if I was focused on something else. There are, but the core competencies are mentioned in the accreditation.
Correct.
So Ron, this is Amy. I'm wondering for the discipline-specific competencies, if you're asking the group to consider what our next step might be on this for discussion further at the next meeting, in terms of whether we should discuss a process, if everybody's interested in perhaps doing something like a good housekeeping seal of approval or something like that. Is this an item that you would like them to consider continuing to think about and to send in any comments for further discussion at the next meeting?
Thank you, Amy, for asking that question. And I would say that, I mean, thus far, I haven't really heard any affirmation that that's a good idea.
Yeah.
And, excuse me, you know, maybe something we ask now and ask again at the next meeting, and then report back to, you know, if it turns out that there really is not an interest in it and people don't think it's necessarily a good idea, then it would be a report back to the full council saying that, you know, the work group doesn't really see a need.
Mm-hmm.
And I do have another comment. So another point that we should make is that if the council started placing a good housekeeping seal, it would place an importance on certain sets over others, and some locals would take that with such importance and neglect other sets without applying critical reflection to sets that are not recognized. Sorry, I think we already said that one.
Any other comments? Anybody want to speak? And probably good housekeeping seal is not the right term. It's really more of an organization who would like to be able to say our competencies incorporate the concepts of the core competencies for public health professionals as noted by the Council on Linkages. That's sort of more of what I think some of the organizations that have requested endorsement have thought.
And this is Amy. I'm also thinking too, when our core competencies were conceived of and developed, there were very specific guidelines used in how to state them, you know, the kind of verbs that are used and that kind of thing. So I would think some kind of process, if we were to go that direction, would include, you know, the fact that there were quality competency statements that were developed, and just kind of a checklist of, you know, we can vouch for this competency set as well based on these particular elements.
Yeah, and back to the comment that one of the participants today made about, you know, giving greater importance, if you will, to a competency set. I think really what we're looking here, or what the question is for organizations who would like to know, or individuals who would like to know, is this set of discipline-specific competencies built upon the core competencies for public health professionals? So you want to know yes or no. It's nice potentially for them to be able to have an answer to that question. It's really not saying this is better than something else. It's more recognizing that this format and that these sets of competencies from the core were used.
Anyway, I mean, it sounds like just a consideration for people to think about and maybe to discuss at the next meeting.
Right. It's the first time we're raising it. And,
right.
Yeah. And maybe the next meeting, what we'll want to do is even set up a little poll so people can give their thumbs up or thumbs down to it. So I think having people think about it a little bit more and for us to discuss it in a little bit more detail next time sounds like a good idea.
Yeah, I agree. And I'm thinking there's something about, I don't know, it's kind of a given in what competency sets you promote on the PHF website, you know, ones that we recommend, the discipline specific and the core. I mean, we're not gonna, you guys are not gonna put anything up there that isn't a good set. So it's kind of implied.
And we have, so you're right in pointing out that we do recognize groups already by if a competency set draws from the core, is connected. And what we're really trying to do is show alignment that you know, you can have sort of, we talk about the core competencies as being, you know, basic foundational skills that apply to everyone, and discipline specific adding all of those extra bits that you need to actually be a well-rounded professional. And so we've always posted on our website competencies that are built on the core and linked to them so that other people can find them. And actually a lot of that comes from the developers of those competency sets requesting that they do it. We have had multiple emails, many of which I will admit to not even making it to our website yet, of people saying, hey, we developed competency sets, we use the core, will you link to them? So it's just kind of, I guess, all part of something for us to think about in terms of how we manage this and best recognize the work that people are doing moving forward. So thank you. I guess we'll throw it back to Amy.
Yeah.
Okay, so we only have a few minutes left. Good timing. And I just want to summarize some of the important pieces that we talked about. We had Julie Sharp talking about the performance improvement competencies. Thank you so much, Julie, for that update. We talked about the great prioritization tool for job descriptions that are now posted on the PHF website. Janet told us about the impact of the core competencies and that terrific map showing us all of the states that are using it, and that's just that 1 year. It's not all the previous years either. We talked about possibly having all of you send in any kinds of tools, or especially articles maybe in progress about the use of the core competencies, certainly finalized tools or stories or anything like that. I was recently at a conference where they showed the brand new the community guide website, and they have stories and a lot of other pieces on this new website that they have told about the use of the community guide. And so I think what we were discussing is something kind of similar to what they've done to update their website as well. And then finally, Ron talked to us about the discipline-specific competencies, and if this work group wants any kind of a role on showing alignment of other competency sets to our core competencies. And so this will be a discussion for a future meeting. So Janelle, did you want me to do all of the reminders, or did one of the staff want to do that? I'd be happy to do it if you'd like me to, on all the additional resources.
Oh yeah, I mean, you can if you like, or we can, either way.
Okay, well, since I have the floor, I guess I'll continue talking. Okay. So as a reminder, all of you are going to get the Counsel on Linkages update, which is the monthly newsletter that regularly provides information on the core competencies. So if you aren't on this list, if you don't get these regular updates, let Janelle know. And of course, her email address is on the slide. Also, there are 2 other monthly newsletters from the Public Health Foundation, the e-news and Public Health Learning, that shares news, resources, events, etc. related to workforce development, quality improvement, and performance management. And again, if you would like to sign up for any of those, you can email Janelle. In addition, we are going to continue to follow up with all of the work group members in the near future to archive and share the meeting summary for today. Kathleen, Janelle, you all do such a wonderful job communicating with all of us and keeping us updated. Of course, anyone who is interested in joining the Performance Improvement Competency subgroup, email Julie about that if you're interested in that work. And as always, we would appreciate any examples of the core competencies-based job descriptions and workforce development plans, as well as any other examples, articles, stories, anything that you want to share.
Amy,
yes.
Amy, you sound like you'd be a great person to do a PBS pledge drive.
I haven't asked to do so, but sure, maybe if somebody asks me, it's hard for me to say no. Anyway, we are at the moment focusing on adding job descriptions to the online collection to kind of go along with this prioritization tool. So maybe if each one of you on the subgroup would be able to contact a colleague after this meeting to see if they have any kind of a job description, maybe within your own organization. If you have job descriptions that integrates with the core competencies, that mentions the core competencies or uses the core competencies, that would be great if you could share any of these job descriptions online. And that's on our phf.org link. phf.org/competency job descriptions. We'd love to be able to share that. And of course, if you have any other questions about this work group, their activities, etc., you can email Janelle. And of course, we don't have the next work group meeting set up yet, but we're probably going to try to schedule one in the fall. And of course, please, please, please come to all of the great PHF and Counsel on Linkages meetings and sessions at APHA. And it would be great to see everybody at APHA and of course our future work group meetings. Anybody else have any final questions or comments before we adjourn? Ron, any of you have any comments or questions or final pieces, please?
I think our only comment is thank you to you and Janet for chairing the meeting, and thank you for everybody for participating.
Thank you for putting it together.
You're so welcome, and thank you all for coming.
Bye.
Bye-bye.